Hello, everyone. It's Friday, October the 22nd. We've lost another 44 people in West Virginia. Again, we're just teetering on the peak of this surge, and I think we're past that from the standpoint of our hospitalizations and our ICU unit people, and or our people that are on ventilators, and so. We're doing better. We're getting through it, and it's been tough sledding, but it can't be any tougher than for these families that have lost these wonderful people. 44 West Virginians were up to 4,263 deaths. But the 4,220th death, a 72-year-old male from Wyoming County, the 4,221st death, a 76-year-old female from Kanawha County, the 4,222nd death, an 82-year-old female from Kanawha County. The 4,223rd death, a 63-year-old female from McDowell County. The 4,224th death, a 77-year-old female from Cabell County. The 4,225th death, an 83-year-old female from Kanawha County. The 4,226th death, a 73-year-old female from Berkeley County. The 4,227th death, a 69-year-old female from Jefferson County. The 4,228th death, an 88-year-old female, the 4,228th death, a 55-year-old male from Berkeley County. The 4,229th death, an 81-year-old male from Kanawha County. The 4,230th death, a 53-year-old male from Roane County. The 4,231st death, a 51-year-old male from Lewis County. The 4,232nd death, an 82-year-old male from Morgan County. The 4,233rd death, a 71-year-old male from Wood County. The 4,234th death, a 69-year-old male from Raleigh County. The 4,235th death, a 55-year-old male from Randolph County. The 4,236th death, a 75-year-old female from Preston County. The 4,237th death, a 65-year-old male from Nicholas County. The 4,238th death, a 63-year-old female from Kanawha County. The 4,239th death, a 76-year-old female from Harrison County. The 4,240th death, a 60-year-old male from Braxton County. The 4,241st death, a 71-year-old female from Mingo County. The 4,242nd death, an 86-year-old female from Fayette County. The 4,243rd death, a 53-year-old female from Kanawha County. The 4,244th death, a 75-year-old female from Harrison County. The 4,245th death, a 57-year-old female from Cabell County. The 4,246th death, a 49-year-old male from Kanawha County. The 4,247th death, an 88-year-old female from Tucker County. The 4,248th death, a 60-year-old male from Putnam County. The 4,249th death, a 71-year-old male from Wayne County. The 4,250th death is a 55-year-old female from Wood County. The 4,251st death is a 58-year-old male from Mineral County. The 4,252nd death is a 60-year-old female from Taylor County. The 4,253rd death is a 65-year-old female from Berkeley County. The 4,254th death is a 77-year-old male from Kanawha County. The 4,255th death is a 36-year-old female from Raleigh County. 36 years old. Unbelievable. The 4,256th death is a 61-year-old female from Nicholas County. The 4,257th death is an 84-year-old male from Monongahela County. The 4,258th death is a 66-year-old male from Ritchie County. The 4,259th death is a 56-year-old female from Clay County. The 4,260th death is a 68-year-old male from Wyoming County. The 4,261st death is a 71-year-old female from Wood County. The 4,262nd death is a 72-year-old male from Mineral County. The 4,263rd death is a 53-year-old male from Putnam County. you know, we read now a lot of 50-year-olds and a lot of 60-year-olds, and then occasionally a 21 or a 36-year-old. You know, we've lost so many of our senior people. We've lost so many that, thank God, we've gotten 92% of our over 65 people vaccinated. But we've lost an awful lot of our elderly that have given us so much wisdom and could give us so much more. You know, all I can do is again and again and again ask for your prayers. We have 8,746 active cases in West Virginia. We have 1,004 new positive cases today. We have a daily positivity rate is 7.37. Our cumulative rate is 6.08. We have over 250,000 that have recovered. We have 686 now hospitalized, 205 in the ICU units, and 116 that are on ventilators. We do have 4 green counties and 42 outbreaks in our school communities in 19 counties with 606 confirmed cases. We have 2 counties that don't have a mask requirement, and that's Pocahontas and Tucker. And those counties have done really well. They've, you know, they've done good work there. You know, a reminder again, if you're 65 and older and got any symptoms at all, please get tested. Please, these antibodies will save your life. I'd caution you again about going into big crowds indoors. It's going to get cold. We keep thinking, well, it's not, and you know, this wonderful Indian summer just hangs on and everything. It's beautiful beyond all comparison. It's just going to get prettier in the days to come. Get out and enjoy the great, great, wonderful, pristine air in West Virginia and this beauty beyond belief. But be cautious if you go indoors as it gets colder and there's a big crowd of people and everything, and you're 65 and older and compromised by health from whatever it may be, you know, think really hard about wearing a mask. You know, from the standpoint of the CDC has now recommended boosters of Moderna and the Johnson & Johnson vaccines. You know, Dr. Marsh will talk about this more in just a few minutes, but the J&J, the Johnson & Johnson booster, is for 18 and older who have received the initial shot at least 2 months ago. You know, from the standpoint of Moderna, this is now limited to the elderly at risk, that adults that are 6 months out, and Dr. Marsh will bring, you know, more and more on, you know, to talk to you about that. We continue to you know, get the people, you know, that got the Pfizer vaccine, 18 and above, and that are 6 months out. And we remind you over and over that we've got the shots. We're ready to go. If you've lost your card, all you've got to do is get in touch with us, and we'll get you a new one at DHHR. Okay, we're at 66.2% that have now received, you know, at least one dose. We picked up another 1,300 people since our last meeting that got their first dose, and that's good. We're at 81.7% of the 50-year-olds. We're at 92% now of the 65 and older, and you know, we just want to keep getting everybody we can possibly get. The vaccine eligibility, 12 and older, you know, our young people, you know, still are dragging their feet a little bit on this, and we need to get these kids vaccinated in every way. Just think about it. Parents, please think about this. These kids, all the medical, you know, knowledge that we have says, and it's not widespread, but it says some of the kids end up with some level of side effects that may go on throughout all their life. I don't know how in the world we cannot, or we hesitate to get our kids vaccinated. You know, so nevertheless, just think really hard about it. Our grand families, you got 19,000 kids. We got vouchers that can come to you. Come on, just try in every way to get more and more and more of our kids across the finish line. The COVID vaccine info line's all up there. From the standpoint of free testing, all available, like I've said over and over. Thanks, Walgreens. Thanks, Proof for all that they've done. Our outbreaks, we have 48 outbreaks in our long-term care facilities. We only have one outbreak in our church community, and that's in Nicholas County. And the outbreaks account for 8 total cases. We're down to 54 inmate cases at 14 facilities. All that's really good. Now I've got some other announcements to make and everything, and I'll just start, I'll just go right dead into it and everything. But yesterday, our amazing, Charleston Gazette, which I've called the Charleston Inquirer over and over because they don't report the news and they don't report accuracy. They look for something bad all the time, and they're becoming the laughing stock. That's just all there is to it, and that's the way I'm going to refer to them and just giggle a little bit about it and tell you the truth. But they reported yesterday on the doom and gloom on PEIA, and I have, I personally met, with Ted Cheatham and all the people there and everything to discuss what we're doing with PEIA. Under my watch, we put $105 million in a rainy day fund for PEIA, did we not? We have drawn that down by $31 million on my watch, and I specifically told them point blank, I told them, I guess you never say never, but I told them point blank the PEIA premiums would not go up on my watch, period. So for as long as I'm going to be your governor, I'm going to try every single way in my power for those premiums to not go up. Now, we can come up, these teachers' unions and these people that are absolutely trying to lead the good teachers, our good service personnel, and lead them in ways that absolutely is untruthful and scare them in order to be able to keep their jobs. And that's what they're doing. You can either trust me or not, but I am the one that came with your great pay raises. I'm the one that has delivered you no premium increases in your PEI, and I'm the one that's telling you, unless there's a meteorite that hits the earth, that your premiums are not going to go up. Now, I don't like this rebel rousing and everything saying, well, we're going on strike or we're going to do this and everything else. And absolutely, that's just a bunch of absolute garbage that's led by union leaders that are trying to show their hind end. The Charleston Gazette, if they are truly going to report the news, they ought to drill down and look. That's all there is to it. The monies that we have already dedicated will ensure premiums on PEI not going up. All I wish that they would do is just report the truth. For crying out loud, why in the world, why on earth would you dig into something to try in any and every way to tear us down in West Virginia? The Charleston Gazette is probably greatly responsible over the years to driving so many people away from West Virginia, absolutely turning their backs on the greatest state in the nation and everything. And we did it until we were 50th and 50th and 50th. And wouldn't stop doing it, and we're still at it today. So they got it wrong. The union bosses got it wrong. Absolutely, instead of sitting back and being appreciative of all the hard work that the legislature and this governor's office and everybody has done in pulling this rope together to keep these premiums from not going up, instead of looking at all that incredible work and congratulating those that have been able to achieve it, what do we want to do? Scare people. You know, it is absolutely just plain out and out dead flat wrong. And so while the premiums haven't gone up on my watch in the last 5 years, they're not going to go up on my watch, and there's dollars there to assure that. And if I could get my way, you know, my way, as we go forward, we're going to lay in even more dollars to make sure that as we go forward, we're trying to protect PEIA and protect our great people that do great work for this state in every way. That's what we're trying to do, and that's what I'm going to continue to try to do. Now, from the standpoint of the flu vaccine, well, let me mention one other thing real quick. You know, finding a dedicated source for PEIA has been really difficult. And our task force, they've tried and everything, it's been really difficult. You know, but along the way, if you'll remember this little guy that's talking to you right now, he came to you right off the get-go in the first State of the State address that I gave and said we should tier our severance tax on coal and oil and gas. He also came to you on the last State of the State that I've delivered, which was last January. And in that State of the State, you know, the same guy that's looking at you right now said, we ought to tier the severance tax on coal, oil, and gas. Because I believed that there was a tremendous potential upside in the coal and oil and gas prices. And lo and behold, it happened. And what would have happened if we would have done that? Surely, you know, our industries, whether they be coal or oil and gas, whatever it may be, they would be paying a little more. But it is so insignificant to the dollars of profit that they're receiving. And my family's in the coal business. I am telling you, just as point blank, it is the biggest whiff that we could possibly have made. We could have surely dedicated more dollars directly for PEIA, but it is wrong. It is wrong for the PEIA people not to have stood up in the meeting and said, well, hold on. The governor specifically said to us that absolutely those premiums were not going to go up, period. Hold on, everybody get that. I told these people that directly. And it is wrong for the Charleston Gazette or anyone to scare people. That's all there is to it. Get your flu shot. I remind you all to get your flu shot. I remind you all about this rental assistance program for landlords and renters. You take advantage of it. This is money from the federal government that we can absolutely get into our system. And if you're out there and you think you could qualify, please get in touch with us and let us try to get you qualified. From the standpoint of the vaccine exemption bill and everything, all that passed and everything, and that's for a religious or a medical, exemption, and the bill does not go into effect until January of 2022. So between now and then, if an employer says to you, you have to take a shot, I would highly recommend you take the shot. I know people have strong beliefs, religious beliefs or medical, mandates or medical, considerations, and I get every bit of that. That was not part of my bill when I put it upstairs, but it was amended to say that we're not going to go into effect until January of 2022, and I hope that our employers will take heed and they'll and I know they will. They're trying to stop this dreaded disease. They're trying to do what's right and everything, but at the same time, sometimes, maybe in trying to look at the big picture, we don't look maybe deep enough at the smaller picture. And the smaller picture is really big to those folks that could lose their jobs or, that have strong beliefs and everything. And I ask that you'll really respect them and try to work with them. From the standpoint of our and I guess it's the Victim of Crimes Acts grants. I really do appreciate the legislature appropriating that $4 million of supplemental on my request and everything, because we need absolutely to look out and protect these great people and everything that are having a tough time. I'm proud to announce, the award of $13 million in the Victims of Crime Act assistance grants to 84 public and private nonprofit agencies throughout our state. The Congress, in their infinite wisdom, basically denied and cut this funding. And so we had to move from our state standpoint and backfill this $4 million. And that's what I have a special thanks to our legislature for taking my request to do so. We need to stop the domestic violence and all this crime that we're talking about here. And there's no way to do it unless we've got some dollars to be able to do it. And the U.S. Congress really, in that situation, is turning their back. And so we backfill. We do the right stuff. I don't know if you saw it earlier, but we had a news conference earlier about 3 counties in Maryland. And those 3 counties are, making a lot of rumbles and everything. And it's Garrett County and Allegheny County and Washington County. And they would really like, and it's 251,000 people. Those counties would really like to move and become part of West Virginia. So we got request after request, especially from a lot of national media, on what's our position and everything. I was joined by, Delegate Gary Howe, who did a great job, and he's from right in that area. And also our Senate President Craig Blair and the Speaker of the House Roger Hanshaw was with us and everything. And plus the fact that one of the news agencies up in that area, spoke of what was going on up there. And so with all that being said, and I think that news agency was from Maryland, is that correct? No, it's from West Virginia. I'm sorry. I'm sorry. Oh, it was a local news agency. Okay, I'm sorry. Well, nevertheless, here's the whole thing. When we're asked over and over by the national media and everything what's going on, we want to report to that, and we want to have an opinion to that, do we not? And so that's why we came out today and issued that opinion. And here's the opinion, and it's loud and clear. It's just as straightforward as it can be. We would love it. We would absolutely welcome with the most open arms. And from the standpoint of those up there, and I was given this in my talking points earlier, and I read this. I'm going to read it to you again and everything, because some of you may have not watched the briefing, on the press conference on those 3 counties. But with just, and it was echoed by our Senate President, it was echoed by our Speaker of the House and Delegate Howe. But just think about this, and I got these in my talking points. They handed me, these, and I hadn't planned on talking about this at all. Now, talking about the Maryland situation, sure, but not talking through these talking points. But just listen to this. Look what's happening today in West Virginia. In the last 3 or 4 years, just look what's happened. You've got budget surpluses instead of budget deficits. You have a rainy day fund of $1 billion+. You have our pension funds at record levels of funding right today. Tourism has gone up so many multiples, it's off the chart. It is off the chart what is happening with tourism in the state. The diversification of our state is really on the move, but we have not gone away and forgotten, and I said it earlier, but who brung you to the dance? Our natural resources brung us to the dance. And we don't want to forget coal. We don't want to forget oil and gas. We do not want to forget our timber industry and all the great water resources that we have. We want the most pristine air and absolutely the cleanest waters. And absolutely, we have that in West Virginia. And we're going to protect that no matter what. But absolutely, we don't turn our back on our energy industry. Now think about this. We've invested in our education system by giving record pay raises back to back, for all state employees, teachers, service personnel. Our programs that have lifted our people out of poverty and prosperity, jobs to hope, communities and schools, our game changers is just starting to happen now. Veterans can live in West Virginia tax-free. There are no state taxes on Social Security for our seniors. We have had the largest investment in our roads, for crying out loud. You can't go anywhere that either the road is not completely finished and everything, or there's orange cones all over the place. We have handled the pandemic, this COVID-19 pandemic, and the nation looks at West Virginia with a great big smile of how they've achieved really goodness for our people. We're in the top 10 in the nation in GDP growth. We have the lowest unemployment rate in the history of our state, the lowest in the history of the state, and we just announced a $1 billion program for broadband to cover our state up. Now you tell me, this is just a few. You tell me, if you're living in those 3 counties in Maryland, and Maryland absolutely is punitive in every way, maybe to your way of thinking and lots of different stuff, why wouldn't you want to come? I mean, why in the world wouldn't you want to come? I say it over and over. We're standing here with open arms, willing and to welcome all those. But in addition to that, we're standing with open arms, willing to welcome anybody from all across this globe. And so here we are, the diamond in the rough, with 4 incredible seasons, with the very greatest people, with natural resources galore, and with all of that within a rock's throw of 2/3 of the population of the country. Here we are standing ready to welcome, with all the goodness that's happening right now in this state. We're reaping the benefits and the rewards of a lot of hard work that's gone in. Each and every one of us, and there's so many that deserve a lot of credit. I thank the Senate. I thank the House. I thank all of those that have pulled the rope together. I thank all of our media partners, how they've stepped up and really pulled the rope. I don't thank those that absolutely choose to try to push us down. We don't need to be pushed down anymore, West Virginia. You don't need to be put in your place 50th. You need to be turned loose, and you need to be embraced and loved and dadgum proud of who you are and what you're doing. You're the best of the best. So just keep knocking it out of the park. I couldn't be more proud of you. Now, another thing that just happened here is Good Morning America just aired some segments, some feature-length segments, about West Virginia this morning. Stephanie Ramos was spent the last several days exploring all kinds of stuff about West Virginia and almost heaven. And lo and behold, it goes all over the place, does it not? Just how great we know it is here. Big thing we needed to change, and it's changed, is our image. We always knew how good we were. We always knew it. But on the other side, really and truly, so many from the outside didn't know it. They didn't know it in any way. So nevertheless, we thank the Good Morning America folks and everything, and Stephanie for coming and giving us the opportunity to shine on a national stage. And so we thank them so much, and we welcome them back any and every day. I love their show, and I just think they do great work. And so you've got my full-fledged welcome any and every day. And the only thing I hate, and she's back in the back of the room, I just heard her, she never barks. I don't know what in the world she's doing there, back here, but I heard Baby Dog. And so, Stephanie, you got to come back sometime and visit with Baby Dog. She's a pretty popular little girl, and she'd love you to death. She loves everybody. But Stephanie, thank you. We really appreciate you. We really appreciate all the folks at Good Morning America. thank all of you. The only last thing I've got is we're going to go to Tuesday and Friday next week on the briefings. And so we won't do Monday, Wednesday, Friday. We'll do Tuesday, Friday next week. That's all I got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. And following up with what the governor had announced earlier, we are very excited that the CDC's Advisory Committee on Immunization Practices, the ACIP group, has now clarified what the FDA approved for boosters. And we know that boosters are a very important part of our strategy to reduce the risk of COVID-19 spread and severe COVID-19 in the state of West Virginia. And basically, to try to make it simple, both the FDA and the CDC decided that for a second dose, which is 6 months after your 2 shots of Pfizer or Moderna, or 2 months after your first shot of Johnson & Johnson, that people can choose any one of the 3 vaccines. You can get your booster dose with Moderna, you can get your booster dose with Pfizer, or you can get your booster dose with Johnson & Johnson. And there's data out there that a first dose of Johnson & Johnson followed by a second dose of Moderna or Pfizer can really elevate the antibody levels, which we presume is good for immune function. And that's something that people should consider if you've had a single dose of Johnson & Johnson. And if you've had 2 doses of Pfizer or 2 doses of Moderna and you're 6 months out, then you can choose whichever whichever boost vaccine that you believe is the right one for you. You could take another Moderna if you've had 2 shots of Moderna, or you could switch to Pfizer, all of which seems to be safe and seems to be effective. And as the governor said, the indications for the Moderna boost, which is new as of today, is that people that are over 65 years old and 6 months after their second dose qualify. And as we have said, the same with the Pfizer, if you're 18 or over and you have a high risk medical condition that puts you at higher risk of having severe COVID-19, if you live in an extended care facility or a congregate setting, or if you have a high risk occupation that exposes you to others that put you at risk of developing or getting infected with COVID-19, then all those groups can get boosted. And as we said before, we think that within the ground rules of those indications, that everybody who has had a first and second dose would be eligible for a boost dose if you're 6 months after the second dose of either Pfizer or Moderna, or if you're 2 months after your first dose of Johnson & Johnson, because we know that the boost dose at 2 months for Johnson & Johnson really increases the benefit of the protection. So that's really exciting, and that's something that we think is a cornerstone of our strategy moving forward, that getting first and second vaccines in all West Virginians who are eligible is very important, but also getting booster doses in all of our citizens who are eligible is equally as important. Now, we know that coming at the next week, the FDA is going to make an assessment on data that was presented from Pfizer on the benefit of immunizing 5 through 11-year-old Americans. And the data was released, and it looks very, very good that 2 doses of the Pfizer vaccine at a much lower concentration of the vaccine, about 1/3 of the adult dose of the vaccine, is highly effective, about 90% effective in reducing infections and symptomatic infections in younger people. And that's really important because, as we've talked about before, we know that younger people can be infected with and can infect others with COVID-19 like adults. And so we really want people, parents, to very much consider choosing to vaccinate your children. We know that very few children can get severely or life-threatening illness from COVID-19, but some can. A higher number of children can get long-term side effects, so-called long COVID. But importantly, as we want to protect all West Virginians, then we know to reduce the spread of COVID-19, then the more of our population that's immunized, including our children, the more we can create firewalls to prevent that rapid spread of COVID-19 like we've seen before. As we look at our own state, we see that we are slowly recovering from our last surge. And we know that new cases are down, and continue to start to reduce. The hospitalizations are coming down as well. Although we see, despite fewer West Virginians in our state hospitals, a greater percent of our hospitalized patients are people that have received their vaccines. About a quarter of our hospitalized West Virginians have received their vaccines. So that's the group that we think is so important for us to give that booster shot to, because we know the longer you are from your vaccination, which is that 6 month threshold that the FDA and the CDC said, the more you'll really benefit from a boost. And we've seen in the country of Israel that as they have really boosted everybody 12 and over, that they have really, really reduced that surge that they were seeing in people that were fully vaccinated. So we know that there is a time dependency, and 6 months appears to be an important time point in which we know that the potency of the vaccines can reduce some. They're still very good, but not quite as good as they were early. So that's the reason why we really, really, really need people to get your booster vaccine. And now we can give boosters to everybody who's been vaccinated before. And if you've not chosen to be vaccinated yet, please do so. In the meantime, it's really important, if you're older, as the governor said, and you're indoors or around people you don't know, please wear a mask. Please get tested. If you have cold symptoms, it's free, because right now is a really important time as we are continuing to see some decline, but we're also seeing, still a number of deaths that the governor's reading every day. So to protect all West Virginians, be fully vaccinated, get boosted, wear your mask when you're indoors and around people that you don't know, and be careful. Take your flu shot to avoid having that problem, and please get tested. And together, as we've done so far, pulling the rope in the same direction, we will not only make it through, but we can be a model for others. Thank you.
All right, thank you, Dr. Marsh. Dr. Ayn Amjad and Secretary Bill Crouch are also joining us today and are available for questions. Retired Major General Jim Hoyer had a prior engagement, and he will rejoin us next week. We'll now go to questions from members of the media. The first today from Paul Mullen with WCBC.
Good morning, Governor. Good morning, everyone. Governor, I have to go to the announcement that you made earlier today about welcoming free counties from Maryland with open arms, because I live in one of the counties and I work in another one of the counties, and I know Delegate Howell is representing an area that we cover on our station. Over the years, we have talked about this conceptually, how this would play out. And if you can get, obviously, I think West Virginia would take the 3 counties. If you can get Maryland to agree and Congress to agree, the big stumbling block apparently would be Maryland would probably want something for the infrastructure investment that they've made over the years in the counties. Outside of the welcome mat, would West Virginia entertain some sort of a financial payoff to Maryland to free up these 3 counties? Thank you.
Paul, I think the way that works is just this is, excuse me, but I think that it is elongated over a very significant time span, like 40 years. And through that, the tax base of the county that's coming would absolutely carry the amount of dollars that it would take to compensate Maryland back. So yes, I mean, there is a bridge, there is a way to do it. From West Virginia's standpoint, there's absolutely a way to do it. And Paul, the only thing I would say to you is just this, is, and I shouldn't have been getting this mint while you were on and talking, but nevertheless, Paul, I would say just this, First of all, you know, Paul, you know how great it would be to be part of West Virginia. And we would welcome you beyond belief, because I just love being with you. And but you know how great it would be. And a lot of those folks in those areas and everything are, it seems like their terrain, their way of thinking and everything is really in tune with what we think and how we think in West Virginia. And maybe out of step in a lot of ways with what's going on in the powers to be of your state. So nevertheless, I think as far as working out the monetary aspect of it, I think that's doable. And from the standpoint of really and truly, we all really know that when we're thinking about something like this, is it would be a rarity, I guess, to think that it could become a reality. But at the same time, if we don't dream and think big and everything, well, we're never going to realize a big dream if we aren't willing to at least think big. And so, with all that, I just say this, Paul. I mean, let's just be honest. I know as well as I'm sitting here that West Virginia would, let's just take it right down the steps. West Virginia would welcome with open arms. That's step one. West Virginia, absolutely, I think there is a solution monetarily to be able to pull it off. From the standpoint of the 3 counties we're talking about and the folks that are there, they want to come. And I hate to say it, but those folks, the people that are the powers to be in Maryland today, those folks are not in step in their beliefs with the people in Maryland that are powers to be, and they may very well be happy to get rid of them. And so if that be the case, well, here we are. Here we are with 4 legs to the stool or to the chair. 4 legs. First of all, West Virginia would love to have them. Second of all, there's a pathway money-wise. Third of all, really and truly, those people, I'm sure, want to come. But on fourth of all, the very thing that you may think, well, that's not going to happen. But I bet you that the powers to be in Maryland would love to see those people migrate away, because from the standpoint of their liberal, Democrat views or whatever like that may be, they'd have a stronghold then. So from the standpoint of possibility, yeah, it's rare. It's a rarity. But at the same time, Paul, the stars may line up. I mean, that's all there is to it. And, we're going to stand here with open arms and be happy if the stars line up. You know what's going on in West Virginia. I mean, great time of day. If you want to be a part of the party, you need to come to West Virginia. I mean, that's all there is to it, because we've got it going on here. So nevertheless, Paul, we'd love to have you.
All right, thank you, Paul. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to ask about the plans to go back and get booster shots to the rest of our nursing home population. I know General Hoyer has previously said, because of the cold storage requirements that we had early on, about 75% of that population were Moderna recipients. What's the plan for reaching those folks, and what's the timeline? Thank you.
Okay. Maybe Dr. Amjad or Dr. Mar, you guys, somebody knows this a whole lot better than I talk, please.
Okay, Governor, I can answer some of that. But Charles, so the cold storage isn't an issue right now because a lot of the Moderna and Pfizer can be held in the refrigerator. A lot of those have changed right now, but we've been preparing for this, so the long-term care facilities are ready to go. The people who have been vaccinating those facilities, the long-term care facilities, the pharmacies, those individuals have been ready, and so they're prepared and ready to actually give the vaccines today, tomorrow, throughout the weekend. But the cold storage facility issue is not an issue anymore. They can be stored in the refrigerator now, so that is not an issue like it was before. But they're pretty much ready to go starting this weekend because they've been preparing for this moment. Thanks.
All right, thanks, Charles. Next to Mark Curtis with Next Star Media.
Good afternoon or good morning, Governor and cabinet members and fellow press members and perhaps future members of the state of West Virginia from Maryland. Governor, you talked earlier about the age dropping, the number of deaths among younger people, not necessarily the senior citizens anymore, people in their 50s and lower. And I got a question from Ken Wood, one of our viewers who watches this briefing every day from Upshur County, and he had the same question. He noted the dropping age of people dying. Do we know, and maybe this is a Bill Crouch or Dr. Marsh question too, do we know what the median age now is in West Virginia for the fatalities from COVID-19, and how significantly is it trending downward into other younger people?
Mark, I'm sure we know, and Bill, you know, you can talk in just 1 second about that. I'd love to hear from you and everything, and maybe we got to go and dig a little deeper and maybe bring and update data and everything. But Mark, my thing that I can see over and over is, you know, we see the 21-year-old or 36-year-old, or as I was talking this morning, but the thing that I see is I see that, you know, where so many before were 88, 84, 78, 94, all of that, and I was reading through that over and over. Now it's so many 50-year-olds and 40-year-olds and 60-year-olds, and you know, the thing that I see that is just really gripping to me is, for crying out loud, you know, all of our older people are dying. I mean, you know, we have lost so many of our elderly. It's unbelievable. You know, I mean, we've got to be reaching a point in time where you'd go to a ball game or go to Walmart to shop or whatever like that, and we've had a real dent as our nation, as the world has, I'm sure, but it's so sad to me because great time of day. Don't you like to spend time with somebody that's been around the horn over and over and has got all the wisdom and the knowledge that can help you, guide you through this crazy life and this journey and everything? And so many of them we've lost. And so Bill, maybe you can add something to it as far as the medium age or whatever, but it's just really sad to me.
Yeah, thank you, Governor, and it is sad. And as we've worked through this surge, we've seen the age drop somewhat, but this virus is still attacking our elderly and taking the lives of our elderly. So that's where the bulk of our deaths are. We'll get that median age and have that for the next press briefing. Don't have that handy. We don't keep that on the dashboard. It's a great question. We will provide more information on that. We track that very closely in terms of the numbers, but we'll have a median age for you next week. Thank you.
All right, thank you, Mark. Governor, I'll turn it back to you.
Well, hold on just 1 second. I just want to look at this real quick. Of the 44 deaths today, now think about this, and Mark, this is what I'm talking about. Of the 44 deaths that I read today, 24 of them were in their 60s, 50s, 40s, or 30s. 24 of them were in 60s or below. 24 out of 44 of the deaths that I read today were people that, you know, you just, to be perfectly honest, I can't believe it, that I'm 70 years old. I can't believe that, you know. It's just like life is just gone and everything. But 24 out of 44 of these people are younger than me, you know, and so one of two things is happening. Either one, we've put a dent in our elderly And a goodly percentage of those folks we've lost. Or two is this thing attacks way more than just the elderly. And we all know, and I've said it many times, you know, that really, when it really boils right down to it, if you're 65 and older and you'd happen to get this thing, you know, you're in for a rough ride. And that's why if you're 65 and older and you get any symptoms at all, you need to absolutely run and get a test. Because absolutely, without any question, you know, if you're 65 and older and you get this, it's going to be tough. Now, they just notified me that our cumulative age has dropped, I think at one time it was 77 or 78, and now it's dropped down to 74. It doesn't seem like a lot, but in all honesty, if you factor in, you know, 14 months of a 77 average or 78 average, and then 2 or 3 months with a whatever the average may be, let's say 55, you're going to then move that total from 77 to 74. So in all honesty, that's kind of deceiving, you know, a 74 number, that's kind of deceiving over 4,263 deaths. And understand now, I may not be many things, but I'm a heck of a mathematician, and I get the numbers deal. But just think about it. Think about it from a weighted average standpoint. If you'd gone through 14 months averaging 77, and you've gone through the last 2 or 3 months, what would you have to average the last 2 or 3 months to bring that whole average down to 74? It'd have to be a lot different. And it is different. Today, on these 2 pages right here, today on these 2 pages, 24 out of 44 are in their 60s, 50s, 40s, or 30s. You know, it wasn't the case before. We've lost a lot of our wisdom, and I hate that so bad, it's unbelievable. But in all honesty, this disease is attacking our younger people too. If you're 65 and older and you're not vaccinated yet, you need to run and get vaccinated. If you're 65 and older and you get any symptom whatsoever, vaccinated or not vaccinated, you should go get a test. The antibodies can save your life. But if you're 65 and older and you get this, and you end up in the hospital, you're in the tough spot, a really tough spot. And the odds are we could very well lose you. So it's a good point, Mark, and it's glaring to me. But nevertheless, you know, let's end on a good note. Thank Good Morning America again for all that they're doing, and hope that we end up, Paul, as a full-fledged West Virginian someday soon. Anyway, thank y'all so much.